Hi again, Dr. Rotchford here with the third topic in opiate use disorders. I'm going to get into some of the basic principles that I've used to help patients in their recovery. The first one, well, the good news is you're already doing. That is, you're getting input. You're listening to me. Now, hopefully, a little bit of what I'm saying is of value, but some input is always better often than none. That is to say, even if it's not that good, just to be getting some input, learning from others, hearing their perspectives, it really enlarges our perspectives on things, and sometimes allows us to kind of change and develop our own perspectives. So there are a lot of facts and information that's helpful in recovery, but just the fact of getting some input along the line and not to hesitate to ask for support. It's great. So number one, here you are. You're already doing it. Number two is, I think, fun. Now, you might not, but it's the notion of paradoxes. Paradoxes mean things that don't make sense to the rational mind. We go, what? So, step 1 in 12-step programs is a great paradox. It's saying if we can come to accept that we're powerless over alcohol or drugs and our lives are unmanageable, heck, that's the first step of getting control. The old brain goes, what? How could that be? I'm powerless, but that helps me get in more control? Okay, we scratch our head. But hey, the reality is it works. There's a lot of evidence it works. There's no doubt that it works. In fact, paradoxes work in all areas of medicine, but they're particularly effective and powerful sometimes in addictions. I think in part because it's our thinking sometimes that gets in our way. We got to get out of that thinking and more in that feeling and the realities of life. I don't know. But in any event, paradoxes are important. And over time, I hope to share some more juicy ones with you that really can enliven your life and your recovery. So, that's number 2, paradoxes. Now, number 3 is the issue around making medications a non-issue, or in more general terms, making the substance of abuse a non-issue. Now, with alcohol, for example, it's really easy how to make it a non-issue. It's just stop drinking. If you don't drink, well, it's not an issue. And guess what? If someone doesn't drink 6 months, a year, hey, things are better. In other words, abstinence is a good surrogate marker for someone with an with an alcohol use disorder. Now, with opiate use disorders, however, it's not a good surrogate marker. That is, the minority of people will be doing good at 6 months or a year if they're not getting medication-assisted treatment. I mean, I really believe that. They may be abstinent, but that doesn't mean they're doing well. I mean, doing well doesn't mean you're abstinent. It means you're abstinent. Doing well means everything's going well in your life. Your health, your finances, you're getting on with things, you're enjoying life, you're not sick, you're not thinking of blowing your brains out, that type of stuff. So, with opiate use disorders, abstinence is not a good surrogate marker. In fact, really one of the best markers there is staying with it, keeping at it. In fact, with most addictive disorders, that's one of the best things. It's just to keep at it. And keep going and keep at it. That works. So if you're continuing with your medication-assisted treatment, getting the behavioral support, getting the input, starting to embrace paradoxes, guess what? I think you're going to be doing pretty darn good. And that's the good news. So I want to share more good news over time next time about some issues around medicines and which ones are the best maybe for your disease and why. And in fact, the medicines we use just on this subject of making the medications a non-issue, well, the ones that work are the long-acting ones, the ones that keep a steady blood level. Your person's not going in and out of withdrawal. That's why methadone and buprenorphine are often the opioids of choice for someone who has the disease, because they keep things stable, level. They help the medicines become a non-issue. That's important. And part of these discussions and these topics, I think, will have to come down to how to help you with making the substances a non-issue in your life. It's a challenge. It's not easy, and You know, I work with people for years sometimes, keeping at it. It seems like something always comes up, whether it's a prior authorization, whether it's a side effect, whatever it might be. But we can keep at it, and in that process of keeping at it, that's where the good things happen. So, some more good news, and till next time where we start to talk about the specific medications, all the best. Thank you.